LGBTQ patients continue to report feeling misjudged, mistreated, ashamed, and stigmatized in healthcare settings. Despite several diversity awareness programs adopted by many hospitals to address those concerns and raise physicians' awareness regarding the unique needs of LGBTQ patients, those programs remain ineffective, and the reason of our study was to try to explore potential barriers for that are causing these negative experiences, and we also wanted to describe pain physicians' beliefs and awareness regarding possible health disparities between LGBTQ patients and non-LGBTQ patients, and we also wanted to look at the level of medical training pain physicians received specifically regarding LGBTQ patients' healthcare concerns. And so we sent a national survey, and we were able to collect responses from 238 pain physicians. We collected demographic data regarding gender, age, and sexual identity, sexual orientation rather. And our survey looked at 4 domains. Level of training was one. We also looked at perceived competency and comfort level treating LGBTQ patients. The third domain was level of physicians' awareness regarding LGBTQ experience in healthcare spaces. And the fourth domain was we assessed for physician bias, whether implicit or explicit bias. And our results show that pain physicians underestimate the level of negative experience their LGBTQ patients are having in their healthcare spaces. 87% of the responses show that they think that LGBTQ patients do not receive less preferred treatment, whereas we know from prior research that LGBTQ patients do not share that same opinion. Perceived competency and physician bias were negatively correlated. So the higher the competency level and comfort level treating LGBTQ patients, the lower we saw physician bias against LGBTQ patients. Awareness of patients' negative experience was negatively correlated with patients' age and years since graduation. The younger the physician, the less the bias, and the more the awareness towards the real experience LGBTQ patients suffer in healthcare settings. About 50% of the physicians surveyed reported that LGBTQ patients have a greater likelihood of having a mental illness. Again, up to 50% were aware of the prejudicial barriers in the healthcare system that are standing in the way of having LGBTQ patients access equal resources like non-LGBTQ patients. And again, they were divided equally between on agreeing whether LGBTQ patients have health disparities that are and unique needs that are different from non-LGBTQ patients. And 85% of the responses reported that being born heterosexual in our society doesn't carry with it any certain advantages, and which shows that they were completely oblivious to the privileges that being heterosexual in our society carries with it. About 16% of the responses of the physicians reported that the lifestyle of LGBTQ patients is unnatural and immoral. So based on these findings, we conclude that the majority of pain physicians underestimate the real experience that LGBTQ patients suffer and report in their healthcare settings. It was also noteworthy that LGBTQ identified physicians seem to be more aware of those negative experiences that are reported by their patients. We theorize that this disparity between what most of the physicians reported versus what their patients are reporting is due to some type of microaggressions, some invisible, implicit type of bias that is preventing physicians from empathizing and building awareness of the real experience that their LGBTQ patients suffer when they see their doctor. We also concluded that it's very important to put in place a curricula, a comprehensive medical education program that is culturally responsive as well as medically responsive to the unique needs of the LGBTQ patients.